Hey everybody, Dr. James Fedich here, Clinic Director at Village Family Clinic in Hackettstown, New Jersey, doing our frequently asked questions. One question we've gotten over time is what's the difference between a chiropractor or a chiropractic adjustment versus an osteopath and an osteopathic adjustment? So it's a really good question, and it goes back to history. So chiropractic as a profession has been around since about 1895, and actually the ancient Greeks were doing chiropractic adjustments, but modern chiropractic 1895. So in the 1900s, early 1900s, if you went to a chiropractor, you would get adjusted very similar to what we're doing now. We wouldn't have all these fancy machines, but adjustment is the same. It's been all the time. We were drugless back then. Main course of treatment adjustment, just like today in 2018-19. An osteopathic physician, or DO, probably a lot of you are going to doctors that are DOs, Doctor of Osteopathy. So back in 1900s, let's say you had chiropractor or DC. Our degree is a Doctor of Chiropractic, sort of initials after name are DC. MD, people think of a traditional doctorate as an MD after name, obviously. They would be over here on this side of the spectrum. They would give the medications, drugs, and surgery. And a DO back in 1900, or a Doctor of Osteopathy, and a chiropractor were actually pretty much identical. If you went into either office, you probably wouldn't know the difference. The main difference in the early 1900s, when these professions were all coming about, the chiropractors believed that a lot of the problems that people were having a problem with was the nerve function, that adjusting the spine would help the nerves function better. Well, chiropractors split off from osteopaths back in the 1900s. Their main difference was that they thought it was blood related. So the adjustments helped blood flow increase and decrease whatever kind of problem they were treating. So that was the big divide between chiropractors and osteopaths. But if you went into 1910 and osteopaths and chiropractors, obviously you wouldn't know the difference. And that went through the 20s, 30s, 40s, and 50s, even after that into the 60s. And the medical docs were always over here, drugs, surgery, medications, that kind of end of it. Well, the DOs started coming a little bit closer to the medical doc side of it, and then actually there was a large shortage of primary care doctors, and basically through a negotiation with the medical side, the Osteopath Society started prescribing medication and filling in this primary care gap. They originally started off only the primary care doc, and now DOs, or Doctor of Osteopathies, have all the rights as medical doctors in just about everywhere in the country. So nowadays, it's always funny, in 1920s, 1930s, you walked into an osteopath's office, and you would have no idea if it was a chiropractor or an osteopath. Now in 2018, you walk into an osteopath's office, you would have no idea he's not a medical doctor. It's always funny when you get the question that chiropractors aren't real doctors, you don't have MDs, those types of things. 7 out of 10 times the patient that says that is seeing a DO for something, a Doctor of Osteopathy. They're doing everything. A lot of primary docs are DOs. I know of a friend who's an anesthesiologist, a DO. Surgeons, they can have pretty much any privilege an MD, not pretty much, they have any privilege a medical doc would have now. So that was the difference back in the day that, I said osteopath and chiropractor, same. Most of the osteopath schools don't even teach adjusting anymore. Some do a little bit. We just had lunch with an osteopathic physician, and they do adjust spine once in a while. It's not really part of their education as they've gone really all towards the medication side. So it's a good question. There's a lot more history to it than that, but I'll give you a brief rundown of the difference between an osteopath and a chiropractor.